So tonight we would talk about when surgery is needed. All right, when surgery is needed, when surgery helps, what surgery would risk, right? Why fibroid recalls? But some people say, "Oh, yeah, good to see you too. Good to see you, my crush." Right. So we'll talk about why fibroid recall after surgery. Because when people say, "Oh, I've done surgery and the fibroid came back," we'll look at some of those information and the real truth about fertility after fibroid surgery. This and many more we'll talk about if we still have time, because it's gonna be long. So this and many more we'll talk about, and let's see where it leads. Is that okay? But the first thing we would begin to address is, yes, now I'm blushing, yeah? My crush said, "Good to see you too." So I have to blush. Oh boy. so so where was I before matter tried to distract me? So let's begin. Let's begin from what is fibroid surgery first? Let's start from there. All right. What is fibroid surgery? If you're here, please tap on your screen. Not for me anyway. See, I can choose not to come on the live stream. But for other people, there are some people that are confused about this result they have. They say they have fibroid. Oh my God, my own is finished. Yes, their own is finished because they are going to all the wrong places. Anyway, so what is fibroid surgery? Let's start from there, right? And now this is the most fibroid surgery is actually the most common fertility preserving surgery, right? I think the technical name for that is myomectomy. So don't worry about the big name. Just know that is fibroid surgery. So it's called myomectomy. Is that okay? Now this surgery, this myomectomy, it actually means the removal of fibroids. Is that okay? Removal of fibroid while you are still preserving the uterus. So you have the uterus and fibroid all over the place. So the surgery is to remove those fibroids without damaging the architecture of the uterus. Is that okay? Is that simple? Is that somebody you understood something? Just type understand. Let me know. Let me be sure. Because we're not going to rush tonight. Everybody will understand something tonight. Right? Who understood what I just said? I said fibroid surgery, otherwise called myomectomy, is the surgical removal of fibroids while you are preserving the uterus. You are preserving the structural integrity of the uterus. That is what myomectomy is. Why? I'll tell you why I'm emphasizing the phrase while preserving the uterus. It's very important. That phrase is very important. So, fibroid surgery is the removal of fibroids while preserving the uterus. Right? Now, the reason why I emphasize that is because it is different from hysterectomy. Sorry, no, hysterectomy. Oyibo people like this thing well. especially when it comes to a black woman. They say, let's have hysterectomy. So those of you abroad, may God have mercy on your wombs. They've not done anything for you. They just, let's take it out. Why? Because they don't want me born to fool their country. Anyway, where was I? So I was saying that hysterectomy is different from myomectomy. And hysterectomy is actually the removal of the uterus, whether partially or completely. As in, something is wrong with your uterus, they take the whole uterus, the whole womb out. That is hysterectomy, which is different from myomectomy. Myomectomy, which is fibroid removal. They remove the fibroids while protecting the whole structure of the womb, right? So that is the idea. And there are several ways they can do that. Whether they open the abdomen to do that, or they do what they call laparoscopy, or through the cervix, right? Through the cervix. So whichever way they do it, these are the several ways they do it. And the way or method they choose to do it is highly dependent on the fibroid size, the number of fibroids, and the location of the fibroids. Right? So that's why you need to engage with your doctor. Talk with your doctor. So that the best options will be done for you. Right? Don't just go in and out. In the end, you now keep on complaining. It was that surgery, it was that. Oh boy. Get out of here. Right? Because it's this lack of understanding that cause people to make mistakes. Right? You know the big mistakes that people make? Many people assume, many people assume that when there is fibroid, when they discover fibroid in their uterus, it is automatically a surgical case. No, automatically there must be surgery. That is an assumption, and I think that is a mistake too. That is false. It's not so. Because you need to understand, if you've been here listening to what I've been saying all the time, not all fibroids disrupt your fertility or disrupt pregnancy. I've said that a million times already. So, because not all fibroids disrupt your fertility, so it wouldn't mean that every time they see fibroid, therefore you must go for surgery. So you keep that at the back of your mind. Then we'll continue. Is that okay? Is that okay? All right. So, having said all that, when is fibroid surgery actually needed? When is fibroid surgery actually needed? I think Akua Otiwa is here. I think I see you. Thank you for the likes. Please, let's tap on our screen. There's somebody who is battling with fibroid. They need to hear this. So when you tap, you give them the opportunity to learn. Is that okay? Yeah, tap on your screen. Oh, congratulations. Somebody just gave birth. Congratulations. All right. Oh boy. That's the kind of news I want to hear. For those of you that are already making progress, I see your efforts. And that's why I'm always committed to people who are willing to walk the journey. Not all these people who just come and ask questions, run away, and they come back, ask another question, run away. Calm down. Calm down. If you are committed to your journey, I will be committed to guiding you. Is that okay? But first, go and download that book. Download it. The preconception blueprint. At least I can be sure that you are actually doing what you're supposed to do. Right? But again, you don't necessarily have to download it, right? First go and suffer. When you suffer, come back. Then we can continue from there. Alright, where was I? I was talking about when is fibroid surgery actually needed. Right? We need to examine the true indications. Remember I said that there is fibroid is not an automatic surgery. Yeah? So when is fibroid surgery actually needed? Now, if you've understood anything I've been saying since last week at all, you already know by now there are different types of fibroids according to their location, right? And the basis for concern when you have fibroid will be more of a function, more of how it disrupts your fertility or your pregnancy than it just being there. That is there does not necessarily mean anything. But what is it doing there? Aha, that is the concern. So we'll start from the most notorious, right? We'll start from the most notorious. That is the submucosal fibroid. Remember submucosal fibroid? The one that is inside the uterus? Yeah, that's submucosal fibroids. Right? They distort the uterine cavity. And that is one of the strongest fertility-related indication for surgery. Why? Because these fibroids, one, they interfere with implantation. Where implantation is supposed to occur, they are basically just sitting down there, like they're just sitting down there, disrupting implantation from occurring. Right? That's one. The second thing is that they will alter the endometrial cavity. Right? Now, when they do, they also automatically be altering the receptivity. Right? Remember what we said about receptivity? The tendency for your uterine lining, the inside of your uterus, is to receive embryo for implantation. Now, fibroid is sitting right there. So it alters that ability to receive embryo, right? And of course, that same location will lead to increased risk of miscarriage. You take in positive for pregnancy, you miscarry. Take in positive, you miscarry because of the location of that fibroid. Kafi is here. Hello, Kafi. I'm all right. I'm all right. How are you doing? I sent you a message. You have not answered me. Right? I'm sure over the weekend you were busy. Or you were knocking waiting no good. You didn't have my time. Good for you. But we want results, right? So where was I? So this submucosal, I know. I've just said it. When I don't get response, I know they are knocking waiting no good. So this submucosal fibroid that is distorting the uterine cavity, right? When you remove them in surgery, what it does is it actually improves the rate of implantation. Why? Because one of the things that is distorting or impairing implantation has been removed. So what happens? There may be higher rate of implantation, right? And of course, pregnancy outcome become possible. That's why you hear some people, oh, when there was fibroid, I was struggling. When I removed the fibroid, I took in and I have my baby, right? Now there are recurrent miscarriages that are linked to fibroids. Yeah, there are, especially those fibroid that distort. You see, the moment the the results or the reports indicates that it is distorting the uterine cavity, that is a problem, right? So these recurrent miscarriages that are linked to fibroids is always in cases where the uterine cavity is distorted. It does not only distort the uterine cavity, it also compromises blood flow. Remember, it's important that blood is richly supplied to that area for obvious reasons. So it distorts the uterine cavity and also compromises blood flow. So at this point, surgery becomes part of the strategy that will preserve pregnancy, right? So if that is the case, surgery becomes. So there are many things your doctor is looking at, and we just look at two of them. Is that okay? Now, another indication for myomectomy, that is fibroid surgery, right, is where the individual have severe heavy bleeding. As I'm saying it now, I'm sure you must have had discussions. Glad it's love. Thank you too. As I'm saying it now, I'm sure you must have had discussions with some people that must have told you some of the things I'm saying with respect to their case. Ruth, John Paul, good evening, you're welcome. So, severe heavy bleeding is a reason, or maybe a reason, for fibroid surgery, right? Because some fibroids cause chronic heavy periods, and that is concerning. Yeah, that's concerning, which of course is tantamount to severe anemia. How do they say it locally? Shortage of blood, right? Yeah, severe anemia, fatigue, and even the person does not function adequately, even in their daily life. When fibroid causes this, it's an indication for surgery, right? So look at all those symptoms. Go for ultrasound examination and discuss with your doctor, right? And don't argue. There are some people while you were yet telling them that, oh, this fibroid is causing this and that, and you may need to say, no, I know my God will do it. I have 2 bottles of herbs that can take out the fibroids. I've said before, if you know somebody with clear medical evaluation before those medications, during the medication, and after the medication, and it was because of maybe the herb or whatever they took that the fibroid disappeared, show me those things. I will advertise for them for free, right? I will. But after all these years, I've not seen. The best it does is to give you hope. To give you hope. Good evening, that nonchalant girl. You're welcome. Right? And it's largely a function of the size. You cannot have fibroid that is as large as even if it's as the size of an egg. The herb or whatever it is you are taking, they cannot take it out. Right? Cannot take it out. Anyway, it's not on the market, but I told you, if you can give me a clear report before the medication, during the medication, after the medication, and we can verify that it's true, I will advertise for you. I will. All right. Another indication, apart from the severe bleeding for fibroid surgery, is significant pain, or these are pressure symptoms. Remember what you said about pressure symptoms, right? Because large fibroids may compress organs that are around it. For example, organs like the bladder, urinary bladder. So what do you notice? You always want to go and urinate. Always want to go and urinate, right? It can compress the rectum, the passage where the poop comes out through, right? It can compress it. Or even the surrounding pelvic structure. It can press and squash them against themselves. And now this will lead to pelvic heaviness, right? Have you seen or heard from somebody who have this large fibroids? I've seen that for many years now, so I'm already right. Large fibroids. For some of them, their tummy is already shooting out, right? So that's what it's doing, compressing all those structures and all that, will lead to that pelvic heaviness, frequent urination, constipation, right? Constipation. You never even get the belly, constipation don't start, right? And in many cases, pain. Is that okay? All right. I know you're here. Please tap on your screen. Tap on your screen. I will stop talking about this tapping. Very soon I'll stop talking about it. I'll just carry all my people to Zoom, give them the code. I just want to talk to only them, right? So that anybody else that wants to hear should come and pay, right? But it's important you learn something, right? Because ignorance has led a lot of people in continuous cycle of nothing, right? And in all this cycle, they were spending money. You begin to wonder, why is it that nobody could just tell you the truth once and for all? Because you're not a cash cow. All right, where was I? So that was that. Now, another indication will be where, that some people have fibroids that are fast growing, rapid growing, increase in size so fast, right? And if the speed at which the fibroid is growing is concerning, it should be taken out. It should be removed. Now, why is it so? Because I think the simplest way to put it is your body would care, nurture, and protect the fibroid as it would a baby, right? So it supplies it all the blood supply, all the hormonal influences it needs, and the fibroid just keep going like that. Even though the fibroid, most of them are non-cancerous, they're benign, right? this unusual growth, sometimes we will need you to take a second look. Why is it growing so fast? Right? Very concerning. All right, that's another indication for fibroid surgery. Then there are fibroids, whether by reason of their location or by their size, they cause tubal or cervical obstruction. Yeah, they physically interfere with the passage with which sperm will travel. They interfere with the same passage with which embryo will travel down for implantation. So the interference of these passages is a concern, particularly if they are located near the tubes or they are growing around the cervix. Very concerning. Of course, I've seen a good number of people who became pregnant, but they have fibroid growing in their cervical. So you want to check my profile. There are videos there on fibroid. So there's one that talked about the location. So you want to check it out, right? But there are fibroids that grow in the cervix. So even though pregnancy did happen, we're certainly not going to be risking you pushing. Pushing what? The passage is closed, right? The passage is closed. Is that okay? So these are all the reasons why surgery will be needed. These are all the reasons. So do you understand anything? Please talk to me in the comment section. Talk to me in the comment section. If you understand, just type understand, right? Talk to me in the comment section. Type understand. Yeah. All right. So now let's move on to the next thing. Today I'm not in a rush. In fact, the reason my testosterone level is low, so I'm not going to be shouting. Slow pace. All right. Thank you. Glad this love. So let's look at now. I haven't known why surgery may be needed. Let's look at when surgery may not be necessary. Right? You know there are people who have actually gone under the knife unnecessarily. You know? Yeah. Anyway, just have knowledge. Is that okay? This is the other side of the gist. Yeah. Surgery may not be needed when the fibroids are small. When the fibroids are small, surgery may not be needed. Is that okay? If the fibroids are if they are subserosal, what is subserosal? They are outside. This is the uterus. This is the inside of the uterus, right? So any one that is growing outside of the uterus is subserosal. So surgery may not be needed when they are subserosal, unless the size are so massive that it's obstructing a lot of things or causing some symptoms. Unless that. Surgery may not be necessary or needed when it is not distorting the cavity. Right, the cavity is where implantation takes place, is where baby grows. Now, none of that is distorted, so it may not be necessary to do that. You can go ahead and carry your baby, right? And if there are no symptoms, right? If there are no symptoms, it may not be necessary to go under the knife. You understand? But long story short, any appearance of fibroid, right, that does not affect your fertility is not necessarily a candidate for surgery. Why? Because it's not affecting anything. Lady G is here. Good evening, Lady G. How was it? Good to see you. So, these are the reasons why it may not be necessary. Surgery may not be necessary, may not be needed, right? When the fibroids are small, when they are subserosal, unless they are too big and they're giving you symptoms, right? It may not be necessary if it's not distorting the cavity. Yeah? If it's not giving you any symptom, don't worry about it. And if it's not a threat to your fertility, your doctor will not worry about it. So that's why you need to have a discussion. Talk with your doctor. You go there, talk, right? Because nobody takes pleasure in putting people under the knife. There must be a reason why it's done. Is that okay? So there are gains, or is it gain now, or merit, or advantage to fibroid surgery. So let's look at the merits. Let's discuss the benefits. Honestly, of course, right? Because I don't go lie for you. May God no come punish me, right? Good evening. You're welcome. So let's look at the benefits of fibroid surgery. But remember, we've already seen when it's necessary to do fibroid surgery and when it's not necessary to do fibroid surgery. Now, having said all of that, what is the benefit when you eventually do it? Benefit number one: it will improve your implantation potential. The implantation rate will increase. In other words, for every time there was fertilization, the possibility for it to implant will increase. So implantation rates will increase because the thing that was distorting the cavity is removed. So it's not your village people that was distorting it. It was actually fibroid that was sitting there, right? So it's now allowing the embryo to come and attach, right? So because you have removed the obstacle. The second benefit of removing or fibroid surgery is for those who had heavy bleeding, like we mentioned earlier, it reduces that bleeding, right? So some people from heavy bleeding experience, now they have lighter cycle. They are no longer anemic. They're no longer anemic, and they are now full of energy. So why were you suffering all the time? Delaying. Eventually, you did the surgery, and now you're better. So it was you that was suffering yourself after all, right? Another reason or benefit is it will improve the uterine architecture, the structure of the uterus. Right? Remember, the structure of the uterus helps you to do this gentle contraction, which is normal thing. So when there is fibroid there, it distorts it. Even the function, beside the structure, it obstructs the function. So basically, when you take the fibroids out, normal shape of the of the uterus will be assumed, right? Which will help your fertility, and also pregnancy will grow correctly, right? Those people who have large fibroids that's causing this pelvic pressure, right? When you take it out, what happens? Of course, you will notice that you're now lighter, freer. It's such a relief, right? Even the frequent urination will stop. Why? Because there's nothing there pressing, just like just like having a stone pressing against your bladder, and of course the pain will disappear. And all that is just even biological. What about the psychological impacts it does, right? For some people, it reduces anxiety that is usually associated with the fibroid body, right? I can relate with that because I meet these people every day. It does something to their mind, right? Especially those that are trying to conceive. Is this the end of fertility for me? Will I ever get pregnant? That kind of thing. So your surgery will reduce that anxiety, and now you come back with hope and gusto. I hope you know that every surgery, not just uterine surgery, every surgery carries a biological consequence. I hope you know. It's not to scare you anyway, but just that you know, every surgery has biological consequence. But let's look at the uterine. Let's stay with the uterine, right? And I'm going to list out just a few of the demerits, challenges, biological consequence that will come from myomectomy, right? And the first one is adhesion. It's not just surgery that can cause adhesion, but I'm talking about adhesion with respect to surgery. Is that okay? Right. And this adhesion is as a result of scar formation. Scar. Can you see that? When after the surgery, the body will heal, then it forms something like that. Scar formation. And of course, you know that the texture of scar is usually not the same as the original tissue. Yeah, so that automatically is a limitation on its own, right? And now this is one of the biggest fertility concern: scar formation, adhesion, right? Because after surgery, right, this scar will definitely develop, right? And adhesion as in sticking together of the wall of the uterus, whether it is forming outside the uterus or inside the uterus, it will definitely form, right? Now, the formation of that scar tissue causing adhesion will affect implantation, would affect tubal movement. Remember, the fallopian tubes are always moving. They are not just there like one tunnel. No, they're always moving for obvious reasons, to help sperm go forward, to help embryo come downwards. So they're always moving. So if there is adhesion, it keeps it stuck or stiff right there, right? So this adhesion can cause implantation problem, tubal movement problems, and the whole fertility expectation is thwarted, right? And the irony of it all is that surgery that is meant to improve your fertility can sometimes now create new fertility barrier, new problems like adhesion. Understood? Please talk to me if you understand in the comments. Just type understand, right? Do you understand what I'm saying? So that you at least know where your problem is. That's what we're talking. Do you know how people have gone in cycles for a very long time? Thank you for the likes. Thank you very much. And one of the things I'm happy about is that for the few people that I've been working with, I look at the milestone, and I want to encourage you, just in case you're listening to me. Don't worry, those um, small signs you are seeing are the improvement of a larger success. So you want to stick to it, right? Don't get discouraged, right? We'll ask you to move forward, keep moving forward. We'll ask you to stop there. But remember, while you are at it, be knocking with no good. Miracle can happen. Natural conception or the other one, regardless, all of them are picking, right? So make sure. And I'm always committed to people that are ready for results, not those who are not ready. If you're not ready, I will just wound you, right? This camera now go to no good, no time. There is nothing beats that, right? Nothing beats that. All right, so we're still talking about the demerits or complication of fibroid surgery. So we'll talk about adhesion, that is scar formation, as the first one. Then the second one, of course, if there was a surgery, it will affect the integrity of the tissue. Is that not so? That's a normal thing. So when you have deep fibroid removal, you may have the thinning of the muscle wall. Thank you very much, Ebony Classic. Thank you. So deep fibroid removal would mean that aspect, that area that is affected becomes thin. Remember the things we said about the uterus? What are you asking? I'm not sure. We're talking about uterus. You are talking about ovarian cyst. So you want to ask your question correctly. Cyst surgery. Like, ask the question correctly so that I understand. Is that okay? Please share the live stream to those who you think will know, especially those that are trying to conceive. For you to get results, if you're trying to conceive, you must be intentional. You must be committed to the journey. Right? Not a little here, a little there. Let me just take that herb. Let me take that root. Let me take that drug, that pill. You're just wasting your time. Anyway, waste your time first, so that when I talk to you later, you agree with me, right? Because people need a hear word. Where was I? So we're talking about how hey, Coach Fano is here. Hello. Good to see you. You're welcome. Welcome to my life. Good to see you, Coach Fano. Right? So the other thing that can happen as a demerit or complication of fibroid surgery is the weakening of the uterine wall. Of course. Good evening. Excellent. Thank you very much. Right? The uterine wall is weakened. That is expected, of course. Right? Because when you have deep fibroid removal, that area may become thin. The muscle wall becomes thin. right? Mr. Tabs is here. You're welcome. And that thinning of the uterine wall will affect the strength, the uterine strength in pregnancy, right? I will not go into those details, but just know that it can. But do not be afraid, though. Make sure take the ugly man out of the way first. Then we'll worry about the other ones later, right? Thank you very much, Coach Farnell, for the gifts. Thank you. Right. Now, do you know that this is why some patients will actually require, um, because of this weakening, right, of the uterine wall, for some reason, I don't the cast updates. That's why they talk small, right? That is reason that's the reason why some patients will actually eventually require CS delivery afterwards. Of course, nobody they will tell you, right? The reason is because there is a concern now of uterine rupture during labor. So nobody wants to take the chances that this aspect of the uterus is thin. So we don't want to now subject the person to labor and the person now have uterine rupture. That is an even worse complication. So what do you do? Quickly do a cesarean section, take it out, and everybody go and rest. Queen Nikki is here, right? So if your doctor is advising you that, the way I'm seeing it, you may need to go for a CS. No, I've done surgery for fibroid. I don't want to go under the knife again. It is for your life. It is for your life, right? The problem is they may not have time to explain it to you in this detail like I'm doing now. But now that you know the detail, you can now approach some of these suggestions, right, from a place of knowledge. Do you understand? I'm gonna be arguing. Say, my God will do it. I cast and bind village people from. I pray too, but when we suggest to you, we have prayed, and part of the instruction from that realm is to do CS for you. Right? You know. Oh boy, some people can antagonize you. The moment you are yet talking, they say, I rebuke it over my dead body. It is not me, not in my family. Not I begin to wonder, trust me, I know God like this. Thank you, Mr. Towers. I appreciate you. Coach Final, thank you very much. So that is the second demerit of fibroid surgery. The third thing is bleeding risk. Right? Do you know that fibroids are highly vascular? Yeah. Anyway, how do they get to grow anyway? Thank you very much, Coach Final. Thank you. My pleasure indeed. Right? They're highly vascular. That's why they grow, because they have enough food, enough nourishment. And who is nourishing them? You. It's coming from the same way your body will feed a baby. The same way it is feeding the fibroids. That's why they grow, right? They are highly vascular, and surgery definitely will involve significant blood loss. Yes, it will. And that's why in some cases you see them asking for pints of blood before the surgery and stuff like that. So just for your knowledge. And when you know that religious resistance that you put, you take it out of the way so that it will save your life. You know how many people who have opposed treatment because of ignorance? But now you know. No excuse. The Rock, long time. Where have you been? Good to see you. So that is the third demerit of fibroid surgery. Yeah. Then that's third. Okay, this is number fourth now. Number four. There is infection risk, of course. There is. But again, your doctor will definitely have due diligence to help you with medications and stuff like that. So don't worry about that. But just know that there is infection risk. Now, this is extremely important. Fibroid recurrence. Somebody asked me the question the other day. That's not the first time I'm hearing that question anyway, but on the live stream, the person said she knew somebody who had done fibroid surgery and the fibroid came back. Did it come back? That is the question. Did it come back? Very important. Now understand that removing fibroid does not remove the biological tendency or potential for others to grow. Now, this is the simplest way I put it the other day when I was explaining that. Now, in myomectomy surgery for fibroid, when they go in, they take out fibroid that we're seeing. Right? We go in, you see fibroid, take it out. They take out the fibroids that we see. Now, there are potential tissues within the uterine wall that can become fibroid, which we're not seeing. You won't see that because they are potential, right? Potential means they are not yet fibroids, but they have the potential to become. Right? And now, since all the bigger competitors are gone, what happens? Enough nourishment. They now grow. So it is not the ones that were taken out that regrew. It is the potential ones that now have opportunity to breathe and grow. Is that clear? Somebody's going to ask me this question tomorrow. But is it clear? Talk to me in the comment section. Just type understand. Right? And now this, do you know that these can actually happen with younger individuals who have stronger hormonal stimulations? Right? Younger individuals who have stronger hormonal stimulations, and of course they also have stronger genetic predisposition. So these two factors is chiefly responsible for the reoccurrence of fibroid. So the ones they took out did not regrow. It's just that the potential tissues grew because of these two factors. Hormonal stimulation is stronger and genetic predisposition, especially for younger people. Right? All right. I know the unfortunate thing about the reoccurrence is it's not rare. It's not rare. Anyway, before I talk about that, please, if you are a woman, a younger female, and having babies is part of the deal, because there are people who don't want to have babies, and we are not forcing you. But having babies is part of the deal. Start early. That's my personal advice from what I've seen and what I know. Start early, right? You cannot suspend reproduction because biology will never wait for you. Make no mistakes about it. You say, okay, I'm not gonna have kids until I'm 35. Uh-oh. Do you know what you biology will never wait for you. You have to build your life, your career around the biology. Otherwise, you spend all your years building career, then now you have arrived. You want to start having babies. Now there's a lot of trouble. And all the monies you made all these years from career, you spend it trying to have just one. Start early. And if you are trying to conceive, the time to start is today. If you want to go for ART or IVF and its cousins, the time to do that is today. Don't waste time. Biology does not wait for anybody, right? Learn to prepare your body for conception, right? And that's why I tell you, if you're trying to conceive or you know somebody is trying to conceive, download this book, The Preconception Blueprint. Is a practical guide on what to do step by step before you conceive. It gives you a better chance, optimizing your success. How do you get the book? Go to my bio, the link there, tap on it, go and download the book. Share it everywhere for those who are trying to conceive, because a lot of them are just doing ignorant things. Okay. So please, if you want to conceive, that is your chance. If you are going for IVF, you still need the book to optimize your chance too. Right? For example, we tell men, of course, we've talked about how to produce precious sperm. 30 days, we talked about it. Majority of the challenges in men is not really that they have a problem, just a little adjustments in their lifestyle will turn the whole low sperm count story. But now they are looking for one drug, that herb, that pill that will boost sperm. Congratulations, you get it. You will get it. You will get it. At least somebody needs to sell, right? Somebody needs to sell market. Just adjust your lifestyle over time. It's just few cases that would need some intervention. Just few. But they are not here in this live stream. So let them keep on spending until they locate us, right? Anyway, I said all that to just remind us that your biology will not wait for you. If you're trying to conceive, build your life, your career around that, right? That's what you need to do. So let's go back to our gist. So how common is this reoccurrence of fibroid? How common? Right? It's common. It's common. You know that over time, some people who have had myomectomy, fibroid surgery, over time, fibroid come back in. I had a lady a few months ago or years ago, I can't remember, but I will never forget. You know, when I told her I'm saying fibroid, she said, "Oh, not again." You know the disappointments. You see the disappointment. See, I've seen people suffer. So when I do these things, I'm not doing it because I have one special benefit. By the way, I'm not even asking for gifts. I don't even get gifts, right? So that's not the reason why I'm doing it. If you see people suffer in your life, you find a way to help them. What about those whose spouse have abandoned them? Let's go back to the gist. And so when I say tap on your screen, it's not because of me. It's because there are people who are looking for answers. So your tapping will actually expose us more to the FYP, and they find us, and they get testimonies. And by the way, do you know that we're very close to our target for June? Right now, we still have 3 more people to complete the target, right? Of those who will test positive before June 1st. How many more days do we have? 5 more days. Oh boy. 3 more people to complete that target. We will surpass it. I tell you, we will surpass it. And all this success that we've had is not because we administer something to them, because we gave them knowledge and they just change some things, and look at success all over the place. So when are you going to put your name on the target? But by the end of this year, a lot of people would have been pregnant. We'll be worried about new people. Right? So I said all that to say that some individuals, thank you for the follow, I'll follow you back ASAP. Some individuals will develop fibroids after surgery has been done, for obvious reasons, right? Whereas there are some others who remain stable, right, for years. So if you are in that category, make sure you are knocking, knock with no good. Make the belly enter. And I tell you, you are a couple, you are trying to conceive, and you are not knocking. Why are you like this? How can we help you now? Because we've taught you everything, but you are not knocking, right? When it's very close to ovulation, quarrel will start in the house. Oh. Should we organize a prayer festival for all those couples that like to quarrel during ovulation? I think we should. When it's ovulation time, you are quarreling. Oh, no quarrel. Resolve your quarrel. Adelove is here. Hello, Adelove. Look for a way to solve that problem. Avoid problem. The moment ovulation is coming, avoid problem. I like what you said. We go knock after we no go talk again. Yes. Suspend the malice. Suspend the quarrel. Knock waiting no good. Then after the ovulation, you can return back to your quarreling. Why? Because we are trying to conceive. And for some people don't believe in devil. So if you don't believe in devil, something is causing you to always have problems when ovulation is near. Anyway, just make sure you are knocking with no good, right? I'm telling you, when I tell you to knock with no good, I have 2 people within the space of 3 months. Usually, I always know that I will know your problem if I will just ask you. The problem they have, they were not knocking. And she is going all over the place looking for a solution on how to. Excuse you. There is no solution. If you are trying to conceive, knock waiting no good, right? If we have to say it like a nursery school rhymes, we will have to say it over and over and over again, right? Knock waiting no good. After knocking waiting no good for 3 months, they came back to my DM and said, "Doctor, I tested positive to pregnancy. So they were not infertile in the first place. They were just knackless. They were knackless. So don't be knackless. And of course, on my live stream, I have zero tolerance to those that are knackless. So if you are knackless, I'm coming for you on Friday. I will pass judgment on you. Go and knock now. And if your partner is far away, your partner is in Iceland, and you are in Madagascar, pack your things. Go and meet your partner. There is no room for distance. Bluetooth knocking is not allowed. Right? So if you don't know what knocking is, maybe you are new here or you are somewhere in the world, you don't know what knocking is. Knocking is sexual intercourse, right? Yeah, that's what it means. Yes, so knock waiting no good. Today is Monday. By Friday, you are supposed to have completed your quota of knocking 3 times a week. If I ask now, how many of us actually met that quota for last week? You completed your quota of 3 times a week knocking. Very few. Very few. But you must knock. So long as you are listening to me, go and download the book. So as you are knocking, you'll be learning. Knock and learn. The baby will come, don't worry. We will guide you. Is that okay? We will guide you. We don't have. There's no reason to deceive you. Miss Kamara, you are intimidating us. I refuse to be intimidated. I refuse to be intimidated. Right? So, I said all that to say, the risk of fibroid reoccurring, right, would depend on age. Remember, I talked about younger individuals with stronger hormones and genetic predisposition, right? So the risk of fibroid reoccurring will depend on age, will depend on the number of fibroid that were originally present. Yeah, it will depend on hormonal factors and, of course, genetic predisposition. Just to buttress so that you go home and understand what I'm talking about. Younger patients often have the higher recurring potential, and the simplest reason is because of reproductive hormone, right? They have longer exposure to reproductive hormone because they are younger. Do you understand? So these are the things you should know. Have that at the back of your mind, right? All right. I hope we've understood that one. Now the other aspect, that I must mention is somebody asked a question. In fact, some people have actually blamed surgery for myomectomy for their infertility. So the question is, can surgery cause infertility? Who's ready for this gist? If you're ready, just do some sharing and tapping on your screen. Let me be sure you're ready, because we need more people to hear that information. Share it. Right? Can surgery cause infertility? Oh boy. Do you know this is one of the biggest fears? I've met people who have come for examination. They blame the surgery for why they have not conceived. See, The truthful answer I can give you is in some cases, right, that may be correct. But with the individual in question, we have to look at the person's history. Long story short, the context in which you are suspecting the surgery for the infertility. So the context will matter. So you don't just say, okay, I had my sister who did surgery, she's still looking for a baby up to today. No, no. The context, right? But even though in some cases you can have, remember I talked about Asherman syndrome, the adhesion, scarring, right? So you can have that as a problem, right? Besides the adhesion, there are also aspects where the endometrium is damaged. Remember the whole thing I said about endometrium long time ago? That's where implantation occurs. Now, if that endometrium becomes a scar, it will not be rich enough to hold an embryo that wants to implant. It will not even be receptive. It will not be receptive, right? So endometrial damage is another thing besides the adhesion. Then if there is external adhesion, that's where another problem comes in. There's going to be tubal compromise. If you're already here, you already know that the tubes are in continuous peristatic movement. those you see that thing that God put here in women? Priceless. That thing has mind of its own. It's living and active. So those tubes are actually in constant peristatic movement, right? If anything would make it not to carry out that activity, it will reduce its function, right? That's what I meant by tubal compromise. Why is it doing that? To help the sperm meet the egg, to help the embryo into the uterine cavity. So now the help that they are supposed to have is impaired, right? So the tubal compromise can happen where there is where you have as part of the complication of surgery, right? And of course, scar formation. We keep on talking about scar, because for every time there is a wound, as the wound heals, there will be scar formation. But remember again that these will risk, they are heavily dependent on how complex the surgery was, right? Because no two surgery will be the same, because the cases may not be the same, right? It also will depend on the fibroid location. Fibroid location. So the surgery you did where they took out fibroids from outside the uterus would impact less on your fertility as against the surgery that was done where masses were taken out of the endometrial cavity. So if scars were to be formed, the scar that was formed inside the endometrium will be more concerning than the one outside. So it's dependent on the fibroid location and the surgical techniques that were used and how the woman responds, or not the woman, how the body responds in healing, right? So these are the what the risk will depend on, right? But long story short, surgery in overall improves fertility dramatically. That's the whole purpose. Nobody just want to, they don't just want to put you under the knife. No, there must be a reason for for that, right? So even though it actually has its merits, it also has its demerits, and the demerit may be some of those complications we mentioned about. So your history will determine the choice or the suggestion your doctor will give to you. Is that okay? Oh boy. So for those who may have been diagnosed with fibroid or something, if surgery is being considered, simple questions you want to ask instead of being afraid. Oh my God. Stop being afraid. Questions you want to ask. As you even look at the reports, you can tell. Is the cavity distorted? Are there severe symptoms? In my case, do I have severe symptoms? Is implantation even impaired at all? Right? Do I have risk of miscarriages because of this fibroid? Right? So if I'm going for this surgery, does the benefit outweighs the disadvantage, the merit? Ask quality questions. Sit with your doctor and talk. Right? But the moment a lot of patients sit with you, they'll forget everything they wanted to ask. I wonder why. So, all right, I'm ready to answer one or two questions. If you have a question, ask me now because it's time for me to go.